Hi guys, you are watching Health Focus with Amy, a platform where we talk about healthcare, activities, all careers and all equipment regarding your health. Welcome. Good morning and welcome to Health Focus with Amy. As usual, I always tell you, this is the platform where we talk health matters. We get different specialties in medicine and any other thing you want to hear in healthcare. Now, do you know that nursing can diversify? Do you know that a nurse can begin from junior and become even a hospital director? Do you know the challenges that you get through before you get to that level? Welcome to today's discussion, and we have a very special guest. I'm lucky she's my friend. We've walked a long journey and we are here. Let me introduce to you someone special. Welcome and introduce yourself to the viewers.
Thank you, Amy. My name is Anne Kirema, a registered nurse at Kenyatta National Hospital, and here at Patient Affairs Unit, not any more clinical, but supports the clinical work that we do. I think that's
okay. Now let's get to hear where you grew up, where you went to school, and just before you realized you need to do nursing.
Okay, thank you, Amy. I grew up in Meru, in a small village called Runogone, and I went to school in Meru. I had an opportunity to do high school in Nairobi, and then I went back to do my nursing in Maua Methodist Nursing School.
All right. Before you go to nursing,
yes.
Which high school is this in Nairobi? Where it's good to promote where you went to school.
Okay, I went to school at the Kenya High School, having done my KCPE way back about 25 or so years ago. And I had passed well, for your information, and one of the you choose the courses that you would want to do at the university. I wanted to be a lawyer, but my cluster would not allow. My next choice was communication, and I didn't get a chance at the university to do communication. My third was nursing, because I know I'm a caring person, very empathetic. Sometimes I sympathize. I cry with the hurting. I take it very personal when I meet with someone who is in need. It doesn't matter whether they're sick, they're hungry, and the poor, and I take it as a call. Because even my background is, I'm a Christian. I forgot to say that. I'm a Christian, a born-again Christian. And it is service to God. So besides wanting to take care of people as a profession, there is the aspect of service to humanity.
All yes. Right. Now you didn't go to do law, you
yes.
didn't go to do communication, you didn't get an invite to the university to do nursing.
Yes.
Because again of the cluster.
The cluster, yes.
So you choose to apply for nursing schools.
Yes. And
you applied to Maua.
Yes.
You got a calling.
Yes. And that journey was very interesting because we had a discussion with my parents. I told them the choices that I have now are narrowing to nursing. And they told me, I'll talk to one of the principals the principal in Maua, and we'll see. The caveat was, I will not do anything below a diploma. Mm-hmm. So I knew what I wanted. I didn't understand what nursing, the stages and the various courses in nursing.
No, but actually I wanted to ask, did you know what nursing was all about? Even at that time you were saying you want to do nursing.
Okay. Now, back again in my family, we have an auntie who worked in a hospital.
Okay.
She was not a nurse. Mm-hmm. But everybody who got sick in our family,
she was the
cousins, uncles, she's the one who was always consulted. Uh-huh. So I was like, And I
It's
think
awesome.
I can also do this. Why not? And that's how I made that decision to have some knowledge, and what I felt was important is how can I help people to make decisions
In health. All right, but you didn't know basically what this nursing
I didn't
entailed.
know. The synthesis of it I did not.
Only that it was glamorous in a family.
Yes.
If you are consultant matters health.
Yeah.
Actually, it was a good thing.
Yes.
All right. They are discussing with the principal,
Yeah.
and you didn't know the stages of growth from
Yeah.
certificate, diploma, degree.
Yeah.
Now take us through that journey.
Well, I knew nursing, Maua Nursing was offering a nursing course, but I didn't know whether it was a certificate, registered, or whatever level. And so I asked my parents, consult further. If Maua is offering a certificate, no. If it's a diploma, then I will go for it. And it happened that Maua was just starting the KURCHN program. And I went for the interviews. I applied, went for the interviews, and I was selected and given an appointment letter to Maua.
And it was the only school you applied to?
That's the only school I applied. I did not know about MTC.
Mm-hmm.
I did not, you know the way you can be so green in some area. Like the way you know there are colleges, teaching colleges, I was very green.
No.
And then when we were growing up also, there is, today we are very lucky because we have people who can mentor you.
Or even internet.
And internet. Our time, our parents knew about teaching.
And
nursing, and I think police.
Yeah, and the lawyer.
Because it was also glamorous.
And the doctor.
And doctor. So, to navigate and to be able to know exactly what you'd want, it depended on what your parents told you.
That's true.
Yes.
That's very true.
But I was also lucky to have enlightened parents. Because my father knew the difference between certificate,
And
diploma, and degree, master's, and all that. He was an educationist.
I bet I couldn't tell the difference.
Yeah.
Now, you got an appointment, an admission letter, you joined nursing.
Yes.
Tell us your experience the first few months in class.
Now, at that time, let me take you back a little. When we went for the interviews, the one question that was posed to me was, Anne, you want to be a nurse, and then what?
Yeah.
And do you know what my answer was? I would like to progress from nursing. I do clinical medicine, then I can be a doctor.
Oh God.
And that's the answer I gave. It was a very interesting, of course.
And you know you are genuine.
I was very genuine because I thought that was the progression. Yes, and inside the training now is when I got to understand the difference.
Wow.
Unfortunately or fortunately, there was no mentorship, career mentorship on
medical lines.
Yes,
actually.
How we were just taught nursing and
doctor.
And that's it.
In fact, it was nurse, clinical officer, and doctor.
Yes.
All the other careers in healthcare, nobody knew about them.
So, and we did our nursing then, 3.5 years, and we left Maua Nursing. And you're out there. The government had stopped
employing
and after school.
Tell us your experience, the first few months or days or weeks in clinical experience after going to class, and then now you're told, go, can you let a patient check a patient or do something?
Yeah, I actually remember it vividly because my first rotation was in labor ward. And that was my induction into nursing. Some of my colleagues fainted. For me, I was brave enough. I even assisted the midwife to do everything. But what put me off was the whole mess.
The first twin.
After the first twin, then you finish up everything, the placenta comes. I never ate meat for a whole year.
Wow.
Yeah, but with time...
What was it with meat? The placenta?
The placenta. The placenta. What I saw,
Wow.
Yeah. But with time, I even loved midwifery. And I even wanted to do, after my first diploma, I wanted to go and now further into midwifery. But there was no provision for that.
There wasn't provision for that?
No, because the only people who used to go for midwifery were people who had just done KRN. So you go and do KRM.
Yeah.
So as we had an opportunity to do...
You are a midwife already.
Yeah, you're a midwife already. So there's no need of going for another diploma that is...
There was no reproductive health specialty that time?
No.
Okay.
There was no reproductive
health.
Yes.
You finish your nursing, then you graduate.
You graduate.
What happens?
The process of registration and being registered with the nursing council took about 6 months. Mm-hmm. Then now you...
Oh, you were home for 6 months without license?
Yes, without a license.
It used to take that long?
I think so, or it's us who didn't know. Because again, as I'm telling you, there's mentorship and being prepared for what is
you didn't
to come.
Have anybody to look up to.
Yes. So we were just told you get a letter from the nursing council and they tell you you register within this period and you cannot practice without a license. So me, I didn't practice. I followed it to the book. No practicing without a license. It is illegal.
True.
So I had to follow the procedure.
So you stayed home?
I stayed home. Then once I got my papers, I told my parents, it's time to leave. To where? I did not know. My parents knew the nursing homes around, the private clinics around. They didn't even know how to get into ministry. So I left. I came to stay with my sister here at MTC.
Oh, your sister was in training now in MTC?
Yes, in MTC, and she was taking another course.
Okay, all right.
So as I was stomaching, I was staying with my sister in MTC.
Oh, okay.
Sharing
in
a
the
bed.
Hostel.
Yes, in the hostel.
Okay.
That's interesting because is it the right thing to do? I don't know. Actually, I didn't have relatives in Nairobi.
And you have to look for a job.
And you have to look for a job. So my first job was with the Anglican Church, a clinic in Kibera. And I worked in that clinic for 1 year.
Wow. That's
1 year.
You were working as the nurse or
the clinic nurse. The clinic nurse was doing everything. You registering, you're diagnosing, you're giving immunization, you refer, discharge, all those. You're doing wound dressing, you're doing everything.
Now, how can you do that and you're just from school?
Yeah.
Like, how are you able to... You are diagnosing, you are treating, you are referring, and you just don't have this work experience that people ask for these days.
Yeah, okay. Before I worked under an enrolled nurse in the same clinic who was a retiree, and she knew so much about minor ailments, treatment, how to manage a clinic. She had worked with the nurse with the Nairobi County Council then.
Oh, okay.
It was county council.
Then she had retired.
She had retired, and so she came to the church. She was working on.
Trend.
Yes, it was a church clinic that didn't have many resources. In an area, Kibera is a slum, you know that.
Yeah.
And so she was just doing treatment of minor ailments, health education, immunization, ANC.
Oh, you were even doing immunization?
Yes. ANC.
There was a maternity?
There was no maternity, but we were doing antenatal follow-ups, and then you refer to the county council clinics or health center. So that's how I started my nursing.
Which was a good experience.
Community health and community service began there.
Wow.
Yes.
Wow. After 1 year you moved?
After 1 year, there was an advert
Mm-hmm.
at Kenyatta National Hospital.
Mhm.
I mean, I had to grab the opportunity.
You applied.
I applied.
Mhm.
Being the Christian I am, I first of all took my application to be prayed for by the pastor,
Mhm.
because at that time there was a lot of myth. If
have
you
to
do not
me.
know nobody,
Mm.
you're not getting nowhere.
If you don't know Annie, you won't get Kenyatta.
Yes.
That was the myth.
So I prayed and I
Mhm.
told my parents, pray for me. And voila, I
You
came.
came to Kenyatta. Which year was that?
2001.
Wow.
2001.
Hey, those are the days that you really have to know me. Actually, it was true.
Yes.
Mhm.
So I came for the interviews, and I also remember the one question that really made me feel I belong was, you're a nurse, you've worked at Kibera. What are the challenges of the Kibera people?
You already knew that.
I already knew. And I was very okay with answering that question. And I was not asked any other question.
Really?
And do you know what? My name was on the newspaper for those who had been selected.
That's how you knew you'd been
That's how I
taken?
knew. Actually, a friend of mine who was on honeymoon told me, I didn't even have money to buy a paper, my friend. So a friend of mine told me, Anne, your name is on the paper.
Trust
Go and
God.
get one. Go and
Trust
get one.
God.
And there I was
To join Kenyatta.
to join Kenyatta, and that's how I began my nursing at Kenyatta National
Alright.
Hospital.
You came to Kenyatta and you were posted what department?
I was posted to, they call it plastic surgery ward. Guess what that is? It's
That's-
a burns ward.
What?
People with burns, people with all sorts of,
Surgical.
not surgical per
crashes.
se, it's burns and plastic issues, like those who have deformities and
Yani
yeah,
restructuring.
for
Those
reconstruction.
reconstruction
Yes,
areas.
yes, so
Could
that's
be a
when I-
crash injury, could
yes,
be a
the
burn.
gloving injuries, the burns, the spinal injury
Which I know.
with
when they-
decubitus ulcers, the bed sores, the very deep bed sores.
Wow.
So we nursed those patients. Introduction again, induction to nursing, very good. And I practiced that for 4.5 years.
Uh-huh.
And an opportunity arose where there was a change.
No,
in-
before we change,
Yeah.
very, very quickly,
Yes.
we are in this reconstruction department.
Yes.
We have a deep bed sore.
Yes.
You know, you're coming from community.
Yes.
And I know from Maua,
Yes.
you don't have this level of exposure
Yes.
to healthcare.
Yes.
So how did you experience it? You know, we have those dilapidated, degloved,
Yes.
and we have those that are minor.
Minor.
What was your experience when you see this degloved
Yeah.
wound,
Yeah.
this bed so deep?
Thank you, Amy. I think one of I would like to say thank you to the nurses we found in that ward. Very committed nurses, very ready to assist you to be able to understand what happens and how to go about it. There is a program called Preceptorship in nursing. That is done in Kenyatta National Hospital for a month.
Maybe I don't think I've experienced it.
You haven't. It
In
is a
my-
very important training or a program that every nurse should be introduced to. If you want to have nurses who know what they're supposed to be doing, they need to be inducted. It's like a mentorship program. Because here is a green person who has never seen some of
And
this. You know,
people-
Kenyatta is a referral hospital, and so you see everything. So I think that program, if hospitals are not doing it and the government doesn't do it, it's a very important
We have done
program
nursing,
for
I've
me.
not gone through that. You just learn on job.
And we had a senior nurse work with you. You could not dress a wound without.
Alone.
Yes. You're taught how to, this is first degree, this is second degree, this is third, this is a graft.
Wow.
And and they walk you through
Until
until
grow.
you're able to do it
Well,
yourself.
you did that for how many years?
But
The ward you were posted.
for 4.5 years.
Then restructuring came up.
Then restructuring or the rotation again. There's usually every 3 years there was a changeover. So I was moved to the cardiothoracic unit. Again, a specialized.
Hey, you're so lucky you've been a specialized.
A specialized
unit.
Ward. Where you have even plastic surgery was a specialized surgery, not
but
general
anyway,
surgery.
In Kenyatta National Hospital, all departments are
specialized. Yeah. So we had an opportunity again to deal with patients with heart issues, and vessel issues, lung issues, esophagus, and all that. Dealing with cancer, with all those.
It's a cool
again, an opportunity that opened now my eyes,
especially cardiac.
Yes, on which route I wanted to take as a specialized nurse, and I chose critical care. So 10 months down the line of being in the cardiothoracic unit, I joined critical care training, and that's a specialized training, a 1-year training, where you're taught how to take care of critical patients. Who need life support, who need cardiac monitoring, patients who have had specialized surgery, heart surgery, lung surgery, vessel surgeries.
Where do you do that?
The Kenyatta offers that diploma, the MTC also. At that particular time, it was only MTC, the Medical Training College in Nairobi, and Kenyatta that were offering the course. And I was very lucky because the Nursing Council had begun to regulate and to examine critical care and I think nephrology. And so immediately after finishing my 1-year course, you were licensed. I was licensed as a critical care. 2007. Nice. 2007, 2008. So I was licensed and registered as a critical care nurse in 2008.
Then now you are permanent cardiac anyway?
Yes. Okay. So fortunately or unfortunately, I worked in critical care briefly after, and I was moved again to the burns unit. Had an opportunity to begin the burns unit, ICU.
Oh yeah.
Yeah. With some of my colleagues, we started how patients who had inhalation burns, because they get issues with breathing, and therefore you have to support them. And I worked in the burns unit for 3 years.
No, it's not burns unit. Actually, it's burns intensive care unit.
Yes, yeah. but we haven't gotten yet there. It's a burns unit with patients who can breathe and others.
Oh.
The very critical, and those who have high percentage of burns, they go to the burns unit. If you deteriorate and you're not able to
ventilate,
you're supported within that unit. It's burns unit. It's burns unit basically. And so I didn't tell you that one other thing that made me or helped me to choose critical care. I wanted to be an air ambulance nurse.
What pushed you there?
When I have committed myself to lifelong learning and studying, and I'm very inquisitive, and I just got to know that there's another aspect of medicine that is air ambulance.
This level, you had not known, apart from hospital-wise specials.
I did not
know like there's any other field.
Any other field. Wow. I just knew I would be a nurse in the hospital, nurse patients in the hospital.
Wow.
And so when I got to do the critical care, I knew that I would want to be an air.
So you also knew this at the time you are applying or at the time you are exiting?
At the time I was applying.
Okay.
Yes, because when you're now in that ward, you understand there are patients who are taken to India, there are patients who go there. And so I that was an eye opener.
That's how you even knew there's air flying.
Yes.
Actually, that's luck of it for sure. I mean, people are lucky that will watch this and know that we have this career. So you do this in burns, you need to stay there for a period of
3 years.
3 years?
Yes. And at the side, I'm doing evacuations.
Oh.
I'm not just in Kenyatta National Hospital.
When you are off?
My side hustle was evacuations. So I did not do bedside locums, as we call.
As some people do.
Yes, I did air ambulance locums for another 4 years.
Wow.
For 4 years.
So you're forever, if you're not on duty, you're flying somewhere.
I'm flying somewhere.
Wow.
And I've sharpened my skills on resuscitation
and
ICU care and emergencies and
Wow.
And I got another opportunity to move now to prime care, which was private ward in Kenyatta National Hospital.
Private ward, the private wards of the institution.
Yes. There's it's like a hospital, an entity, another entity within Kenyatta National Hospital.
It's a private unit.
Yes.
In the hospital.
In the hospital, run differently. You apply, you go for interviews,
really?
For suitability interview, and you're selected.
So for you to work in the prime departments of
Kenyatta National Hospital,
prime departments of Kenyatta Hospital, you apply for that position.
Yes.
It's not like by luck that you've been deployed there.
No.
Okay.
You apply for it, and you go there.
Okay.
Again, I sharpened my skills on
private management, patient satisfaction,
wow. Patient-centered care, looking at the needs of that patient.
That experience.
It was awesome, working with cream de la creme of the specialists. So again, it was a good experience.
Wow.
Now there you're exposed to different specialties.
I know. I feel it.
Whether it's in medicine or it's in surgery, in gyna,
Actually, the management of prime care in Kenyatta is like, can I say it, the level, these big hospitals in Nairobi,
yes.
That model.
Yes.
So that you don't have like a medical ward.
Yeah.
You have patients for this consultant, for this consultant,
yes.
for this consultant.
Yes.
So you have an experience of all consultants.
Yes. And it's a beautiful thing to have that experience.
It is.
It makes you understand nursing at another level.
True.
Yes.
True.
You are able to work with the consultant and make decisions on patients.
You now use your knowledge.
Yes.
You know, the kawaida sections
yes.
is like you are implement, do this,
yeah.
take this,
yes.
turn this,
yeah.
check this, give this.
Yes.
But those areas, I've not had a chance to work in these other areas.
Yes.
I've had a chance to work in these big areas where it is consultative.
Yes.
We are doing this.
We are doing this. Your patient is not doing well. Can we change the way we are?
This is the true
yes.
healthcare service.
What is the plan? What is the plan of the patient? If this doesn't work, then can we explore this? And I think every nurse should have an opportunity.
I feel so.
And prime care resources are available.
Yes.
In the general wards, resources are limited. That's a different. You would want to do 1, 2, 3 as a nurse, but do the resources allow? We have learned even to improvise as nurses in the general. In the private or in the prime care, resources are available. And
we've learned as nurses in the general healthcare service delivery to just not ask and not talk.
Yes.
Like not be advocates of the person you're taking care of.
That is lacking.
Yeah, that's lacking.
That's lacking.
Not knowing that you're supposed to be an advocate.
And then I worked in that unit. A time came, and now I'm balancing between my family,
social life.
Yes, social life and work. You have to find a balance as a nurse, otherwise you will lose it. Are you still evacuating? At that time you were at prime care? I had slowed down. Okay. And now children are coming, and I slowed completely, and I said, now let me focus on my family. And then an opportunity again arose to work in the cath lab and the cardiac unit, and I moved. You cannot separate the patient satisfaction with your daily stuff, and therefore you put your team together, have the resources, and to some extent have the strategic direction. That's true. Of the unit. Where are you headed to in that period of time? The head of unit is a doctor, yes, but the consultant is not there 24/7. Will never. Yeah, so you realize that in meetings it's you to go. If there is any negotiation to do, it's you to do. If there's budget meetings, it's you to you budget and you go and defend your budget. and see why you need that kind of
And
budget.
that is where, when you get a lousy manager, sorry to use that word, the department will be lapsing, complaining, having no resources, no
Yes.
strategic direction,
Yes.
and they're saying doctors are not doing because they're saying the unit head is the doctor.
Yes.
Whereby it's totally for this nurse manager to ensure that things are moving anyway.
Yes.
Because the policies have not favored nurses to unit head.
Yes. And that is what advised me to go and do a course in management.
Mm-hmm.
Because I realized I'm at a level where a lot is expected of me, and yet I do not have the skill.
Mm-hmm.
And I applied for health system management course,
Mm-hmm.
which I took for almost 4 years.
Mm-hmm.
Almost 4 years.
And I'm glad to say, like, that's where we met. We were classmates.
Yes.
Yeah, it's good to note.
A very good course
It
for
is.
any person aspiring to make change
It
in
is.
management
It is.
and the way service delivery is delivered.
It changes your perception. About
Absolutely,
health. Yeah.
absolutely.
Yeah,
The issue of thinking about the 6 pillars, you have to know financial management
yeah.
as a manager. You have to know how commodities are procured, procurement process.
Mm-hmm.
You have to know how you allocate resources without wastage.
Yeah.
And
You know how to do skills balance in your
yes,
section.
human resource. What do you need? Succession planning,
And
and
excellent course for any healthcare manager.
any healthcare manager should. In fact,
Mm.
this is where our nation should be going. Yes.
Yeah.
If you asked me, that course has given me a different thinking.
Yeah.
Critical thinking, yes, is everywhere, but this one gave me the oomph.
A reasoning power.
Yes.
Like you have a reason why you're saying this.
Yes.
Then now after doing this health systems management,
Yes.
where did you do it? We what?
When
Yes, that
or where? This is we did it at Kenya Methodist University, Kemu.
Of course, she had to take me back to Meru.
Yeah, and we graduated.
We did.
We were very happy about that. But well, yeah, it was
It was an awesome experience.
an
in
awesome
school.
experience. It
It
was
was
an
an awesome
online
experience.
course,
Yes.
both online and
And
face to face.
Mm.
Very intense.
It was intense.
You needed a lot of time.
Yes. And you need to work hard.
Yeah.
I keep on reminding people, like, healthcare courses, there is no easy.
The areas that I felt were quite difficult for me, accounting, yeah,
You don't say
a bit of economics,
Yeah.
nurses.
Yeah.
You need to know how to.
Nursing, please get this accounting knowledge.
Yes.
Yeah. So that's what enables you to do budgets and to do allocation of resources and to make economical reasoning. Why I'm buying an incubator and not a BP machine at this time.
Yes.
Exactly.
And how many incubators do I need
At this time.
at this time?
Exactly.
And we were even taught issues of capital budget, recurrent, and all those things.
It was an awesome
It
training.
was an awesome
Then
training.
after that training, you came back to do cath lab again?
I was still in cardiology, by the way.
Mhm.
I was the unit in charge and still doing the clinical work, and I was in school. And that is why my evacuations,
They will close.
we had to stop that.
They had to stop.
But of course, I mentored and I initiated some other people to join
And
in.
again, I don't forget to tell nurses all the time when we're doing this video that every age has some energy that needs to be used. You can't be doing evacuations at 50 years, surely.
Yeah.
You can't do evacuations at your 40s.
Yes.
Evacuations, you should be doing them in your 2030. And,
Yeah.
and thank you, Jesus, you're done, you move on.
You move on.
Exactly.
Yeah, and that knowledge that you have, please share it with other people.
please.
Mentor someone else to make this profession better. Yes.
Then now, how did you find yourself from getting out of cath lab?
Now there was a need to have quality embedded in whatever we do in Kenyatta National Hospital. People know one aspect of quality, which is quality assurance.
Yes.
There are many dimensions of quality.
True.
There's safety, patient-centeredness, there's a process improvement, or quality improvement, as they call it. And so, graciously, my director was looking for people who could support the start of the department and move it to the next level. And she didn't know me. She was given my name by somebody who I do not know. And she called me. We are starting this department or this unit called patient safety. And would you be willing to support? I said, gladly. Why not? And process after process, we were told now you need to come officially and full time. And that's how I landed here. Yes.
Somebody watching this will think that it has been easy. Come, sit, stand, sit
Move.
here, stand, sit here. It's hard work.
It's hard work.
It's resilience. It's consistent. And it is continually improving your knowledge.
And to say that it is commitment.
It is commitment.
To what you do and do it the best you can.
So for someone who doesn't know what this patient safety is all about,
yes,
what is the role of this patient safety and how does your day look like?
Okay.
If somebody wants to pursue that line.
Now, before I talk about what patient safety is, there was reorganization again in the quality department. And we were moved. I didn't actually sit in the patient safety unit, but I was moved to the patient affairs unit that promotes patient-centeredness.
Wow, okay.
Okay,
right.
Patient-centeredness, and we are the ones who drive the vision of the hospital, which is a world-class, patient-centered, specialized hospital. Wow. And that is Kenyatta National Hospital.
Wow.
We work with the patient to identify their needs, and we plan on how to meet their needs.
So you collect data from patients from all units, analyze the data, see the need at that time, so that you can move to
the next level. One thing we do here is there is policy development. There is assistance to process or quality improvement initiatives in relation to patient-centeredness. We promote the patient rights and responsibilities. As you can see, there is a patient charter here, Kenyatta National Hospital, which is a requirement for every hospital that is patient-centered.
Wow. And let me add to say, like, you can't be equipped to do this work if you have not done health management.
Yes.
You can't.
Health management gives you the ability, the skills.
Wings. Let me just add. Of course, it's not my interview, but I keep on saying, had I not done health systems management, whatever I do right now, I told you I do quality assurance. I couldn't have done anything regarding patient quality, patient processes, patient service delivery, economics, and all those things, policy formulation. You can't do anything in healthcare without that knowledge.
You can't. Yes. And then, of course, now we add the patient voice in their care.
That's true.
We have moved from being paternalistic, where the physician is the one who says.
I say.
But we are working with the patient together.
What is good for
the patient.
That's the point.
Yes, you have the knowledge, you have the skill, you have everything, but the patient also has autonomy to make the decisions, and that is what patient-centered is.
All right.
Seeing the needs of the patient through their eye.
That's true.
When I say I have pain, please don't dispute.
Don't say I don't have pain, good pain threshold.
Yeah, just assess that pain and work with the patient to be able to alleviate that pain.
Right.
The other thing about now nursing, not nurse manager, is leverage on the nurse, the theories of nurses.
That's true.
The theories of nursing, that there's needs, there's the humanity side of it, and all that. Nurses know the theories. So we should not just think about the aspect of the science. There's the humanistic side of delivery of care.
That's true.
That's what I would emphasize, that as a nurse, please do the best you can to make life better.
I think so.
And
build yourself.
Yeah.
Build yourself.
Commit to lifelong learning.
That's true.
I have done several courses. Even after going to KMU, I make sure at least every year I have a short course in leadership. They are there in a global health e-learning platform, Washington University, Global Health, Washington.
E-learning. You don't have to
e-learning. You don't have to. commit to lifelong learning.
Don't
So
you
that
do-
as a professional, people will look at you and say, there's something
Wow.
you're giving.
And know your strength.
Yes.
If you are born a leader and you've done critical care, please don't sit there and say you are a critical care and start complaining you are seeing patients, things are not coming.
Yeah.
It is you who
Yeah.
have closed your house.
Yeah.
And please let's grow. Whatever you are doing in your 20s, now grow, leave it for the other people to come
Yeah.
on board. Just grow.
Yeah.
I don't know how people will think like we are lucky. You know, it's not luck, it's hard work.
Yeah.
It's hard work and commitment.
And commitment.
Nothing comes for free.
Yes,
Even
that is
if-
true. That is true. And nursing is a noble career, as I said. Those who would want to join nursing, there is the soft side of nursing, which you must apply.
Yeah.
You have to be empathetic.
That's true.
You have to, the patient has to earn your trust.
That's true. Even
And-
your colleagues.
yes.
Not patients alone.
Yeah,
Mhm.
and nursing is not just for the money.
Mm-hmm.
Yes, you earn money, but that's not what gives you satisfaction.
That's true.
At the end of the day, once you touch that client, you are able to advocate well and tell or share with the doctor and say, this patient is not doing well.
Alright.
Can we move
That's
to this direction?
true.
That's
That's
what a
what-
nurse should be able to do. Yes.
So if today somebody takes you to the board in healthcare, Uko Afya House,
Yes.
what is this one thing that you will want vocalized in relation to healthcare or in relation to nursing?
In relation to healthcare, universal coverage. Universal healthcare. For the poor, healthcare is not only for the rich.
Yeah, sure.
Strengthen more the facilities that are there, like NHIF, to cater for everybody.
That's true.
Linda Mama is doing a good job,
Mm-hmm.
but it's not good enough because there are mothers who get complications and that card cannot cater for them. It needs to be strengthened, it needs to be supported, and more resources given to that area. The other thing I would say is infrastructure. Let us not look at buildings and say we have a hospital. There are issues of oxygen, there are issues of machines, equipment.
Even their maintenance.
Yes, one thing I've heard the counties talk about, ICU beds. The ICU bed is not just that physical bed. An ICU bed entails the monitors, the ventilator, having oxygen available, and staff, and especially trained critical care nurses. You cannot run an ICU without skilled staff.
No, you can't.
Yes,
No, you
and pay
can't.
them well because they do a good job.
That's true.
I would say universal health coverage, infrastructure,
and remuneration.
human resource remuneration,
All
and they
right.
will have a perfect system.
All right.
Yes.
Wow, that was such an insightful discussion, and I believe it has enlightened your life. I want to tell you, Health Focus is the place to be. If you've not subscribed yet, then what are you waiting for? Really, where are you and what are you doing and what are you waiting for? It's free. It's down here. It's free. Subscribe, and if you know of a specialized person you want us to engage in this platform, give an inbox. If you know someone that will give a good content and a good information concerning health services, speak to me and let's engage that person. And if you know something that you want us to highlight about, again, I'm so here. Let's talk and let's encourage one another. This is where healthcare thrives. Thank you, and let's meet again the next season.